The Dental Association says financial help for those who can least afford dental care is an ambulance at the bottom of the cliff. Help for the low paid is available through work and income, but the association says this only covers emergency work, and there is a case for increased government subsidies to help people get the care they need. Conan Young on this story.
Couple Jared and Mel Smith admit to having terrible teeth which cause them pain and much more besides.
Does your head in? You can't think. I've got 5 children. I've been getting grumpy. Just no good.
And your appearance as well. You know, it like puts you off like going to get a job for starters. Even just like talking to people, covering your mouth, and bad breath.
Going through the hospital is their best option, but even then, there's a long wait.
I mean, my teeth are buggered. I need all my teeth pulled out, and it's going to cost over about $4,000 or $5,000. So going through the hospital is probably going to cost about $300-400, which is a lot cheaper.
There's a long wait to get on. It's up to 4 months for our teeth to come out. So, yeah, I was in agony for about 2 months, wasn't I? And I went there the other day and they pulled out 2.
The president of the Dental Association, Bill O'Connor, says work and income needs to offer more financial assistance so people don't put off getting treatment they desperately need. He says not enough is being done to stop people like Jared and Mel from ending up with teeth so bad they need to have them all removed.
It's probably not enough for most of the people that use that service. You know, it'll get them out of pain and get an immediate problem fixed, but it doesn't solve long-term problems.
Mr O'Connor, who is also a dentist, says the argument could be made the government needs to extend free dental care beyond the age of 18, but it's complicated.
Yeah, I'm sure there's a case for it to be made to be subsidised for a longer period of time. I guess where do you stop, and how much is it going to cost? Kids leave school or leave the system at 18 and they should be dentally fit. So you could, I don't know, where do you stop?
So just how expensive is it to visit the dentist? A filling I had recently at the Linwood Dental Centre in Christchurch cost $160. But across town it could have cost more, a lot more.
Thank you for calling Lumino, the dentist, Christchurch City. You're speaking with Jake. How can I help?
Oh, hello. Look, I'm just wanting to know how much you charge for a filling.
Depends on the size of the filling. So very small, about 200, and a ridiculously large filling is about 350.
It was a similar story at 2 further dentists I called, up to twice as much as the filling I paid for at Linwood Dental, while a fourth charged just slightly more. A root canal would set you back between $1,000 and $1,300. My dentist, Peter Payne, says he charges less because that is all most of the people he sees can afford.
Dentistry has to be sensitive to the patient's ability to pay, but we can't charge so little that we can't buy the right products. If I buy an electric drill, I don't buy the most expensive one, I buy the mid-range.
Mr Payne, who has been working in lower socio-economic Linwood for 40 years, says the two main reasons people don't visit him as much as they should are a fear of going to the dentist and the cost. He says for those who can least afford it, help from work and income is available, but not always.
We do a lot of quotes for wins, and they will provide money to people. It seems to be on a haphazard basis. Some people can get all the money, we might say $1,500 for some cases, and other people struggle to get $200 or $300.
When it comes to getting your teeth fixed, it really does pay to shop around. A Consumer New Zealand survey across the country recently confirmed RNZ's experience in contacting dentists in Christchurch. Its chief executive, Sue Chetwin, says it found a huge variation in what they charged, from $80 to $500, depending on whether a composite or amalgam filling was used.
Most of the practices would give us an estimate, if you rang up and asked, well, how much would a filling cost, obviously those are quite broad numbers. But we found some dental practices who refused to even give that sort of estimate, and we thought that was poor because, people should be able to shop around.
Where you live also impacts on the price. Auckland has cheaper dental care than the other main centres.
In Auckland, for separate appointments for an exam and clean, it was $226, in Wellington $284, in Christchurch $240. So there were some, I guess, when you're looking at that sort of money, it's starting to be reasonable differences.
The chances of any sort of help from the government towards the cost of dentistry currently look slim. Asked for comment, Minister of Health David Clark replied with a statement saying that while he wanted dental care to become more accessible and affordable over time, there were no immediate plans to change the current entitlement age for free care beyond 18. For Checkpoint, ko Konanyang Tēnei.